Everybody is working together to advance the care of our patients. And how crazy is it that you can take the hard work of so many people and just throw it all away because you didn't wash your hands one time? At Faxton St. Luke's, we had one of the highest healthcare facility onset rates of C. difficile in New York State, which was clearly unacceptable.
C. difficile is an acute infection that patients get. It's a bacterial spore that is very difficult to kill within the environment.
Illness from the organism can range from a mild illness with just diarrhea to a severe illness with toxic megacolon and severe sepsis that can result in the patient dying.
Everybody's looking at it very seriously. Could be a family member of mine. It could be a family member of any of our staff members. So we want to do the best we can.
We continue to struggle with our rates, even though we had the basic recommendations in place.
We know that we have to get people to wash their hands, we have to get them to clean the hospital, and we have to get them to use drugs responsibly. So what are all of the tools that we need to make that happen? We kicked off our C. Differently campaign. We did that by introducing the mascot. Every Friday we had C.diff Friday, and we would wear our C. Differently shirts. The senior leadership had custom-made ties with Flora on them.
We met as a group and we pulled in key stakeholders that we thought needed to be included in this project. Environmental services, our pharmacy services, the IT folks, and our nursing staff. We really focused in on the environmental services.
We're going to monitor occupied beds, and we're going to look for beds that are noted as C. diff. There'll be an isolation sign that's on the outside of the door. They're going to use an Oxivir wipe. They're going to cycle through the room. They're going to touch all surfaces. Next step, they're going to mix a brew tab, which is a sporicidal cleaner. They're going to re-clean the room.
We purchased large wipes for people to use on the screens. Also, they can be used on staff members' stethoscopes.
Finally come in with our surface-side machine, which is a 3-tower unit. The unit maps the room, decides how long it's going to need to run, and it will run a cycle.
And so that we had a really great process for cleaning the rooms with environmental services, and then on top of that, every single C. diff patient room discharge would get UV'd after terminal clean.
For the first time after the initiation of this campaign, we saw that state benchmark and that CDC benchmark underneath the national and state thresholds.
We went down from the mid-60s to starting to implement in 2017 to 51 to the low 30s by 2018, which was a dramatic drop from where we were. Each case of C. difficile costs tens of thousands of dollars. The savings of reducing the numbers from the mid-60s to the low 30s is tremendous. It's hundreds of thousands of dollars.
When you have good people and you have great buy-in from your key stakeholders and you have all the attention of the staff on board, you can improve your outcomes.
You can have a passionate infection preventionist who wants to lead the team, but your team has to consist of everybody for you to be successful.